Trauma and PTSD symptoms or anxiety and depression or panic disorder related to trauma history often goes undetected and untreated among older adults. And so I want to talk about why. The first is underreporting. There's often stigma, of course, associated with sharing about trauma experiences. There's often underreporting due to shame, stigma, and generational silence around, I don't want to share my emotional baggage. Often, when it comes to older adults and trauma, a family member is concerned about the older person's current mental health experience. And so they may be encouraging the older person or your older client to go to mental health treatment. And if they're in the room with your older client may be reluctant to share for want to protect the relationship with the person and also for want to protect themselves and the vulnerability that often arises in doing trauma work. And so when I'm working with family members, I often will say, we'll meet together, then I'll meet with the identified client alone, with the caregiver, if appropriate, alone, and then all back together. And so in doing this work, you need to be very flexible in your approach, but also have enough clinical authority so that you're guiding the approach. Because sometimes very distressed family members will want to guide the approach, and you, with your clinical authority and knowledge and wisdom in providing care, will need to be a clear manager of how the sessions go. I've worked with many World War II, Korean War, and Vietnam War veterans where it is not appropriate to talk about their combat experience with their family members. Maybe their family members don't know how to respond. Their family members aren't trained mental health providers. Even if they are, they're not that person's mental health provider. And so it takes a lot of sophistication in navigating trauma assessment with older adults, especially when a caregiver is involved and needing to be involved. You don't want to alienate the caregiver, but finding a way to protect the therapeutic relationship and the trauma work without alienating the caregiver takes finesse and grace. And so I talk more about how to do caregiver family therapy in my large certificate program, which is an 18-hour continuing education course on meeting the mental health needs of older adults. So I hope you check that out when enrollment opens. Okay, let's get back to what keeps trauma from being identified among older adults. Another is avoidance, and with post-traumatic stress disorder, avoidance is one of the hallmark symptoms of post-traumatic stress disorder. And so avoiding anything that will remind you of the traumatic event. So if a clinician is going to be asking, tell me about traumatic events in your life, it's going to be hard for the person who's experiencing PTSD to provide that information because one of the symptoms in and of itself is avoidance. And so they may not want to talk about it. They may avoid coming to appointments and so on. And so that's another reason why trauma goes undetected and untreated. And then that's avoidance from the client side, but then there's also avoidance from the clinician side, especially when working with older adults. Back to this idea of ageism, that the older person can't handle this difficult conversation, when in fact, as we age, we develop more and more resilience and better problem solving and better emotion regulation. And this isn't like older adults have it and you don't. This is you and I and each of us. As we age, we cultivate this. And all of us to different degrees, of course, because where we start out is very different. But this happens throughout our maturity process as humans. And so what happens though is we have this false belief that older adults may not be able to handle this conversation, and so we fragilize them. Or will it matter now if we do trauma work? And so we dismiss their opportunity to heal and grow and transform from these experiences. And that is ageism in action. And so as professionals, we need to counter that. We need to invite the older person into a conversation and change the narrative that we have been fed by society about older adults and their vulnerability. As we age, we have more physical vulnerability, but greater psychological strength. And so use the psychological strength in these conversations. And so when you find yourself being reluctant or uncomfortable asking for fear that it will tip the older person over the edge or or the older person may be too fragile to handle it, think again. And of course, we need to be thoughtful and cautious and clinically sound in doing this work, not forceful. But when the ageism creeps up, challenge it and go in the other direction. And because the truth is, older adults are capable of change. There is no expiration date on healing, transformation, and growth, and are as deserving as mental health care as anybody else. And trauma treatment does work for older adults too.